Hello, my name is Dr. Shane Martin. I'm a chiropractic doctor, and I have an office called Mission Clinic, and I partner with Telehealth Clinic. So what we'll be going over today is we'll be going over the thyroid imbalances and how to treat it from an alternative and holistic point of view without pharmaceutical drugs and without surgery. So first off, what we'll be doing is I'll be giving you a background, some like the issues, even the anatomy with the thyroid. And next we'll be talking about some do-it-yourself techniques for treating the thyroid imbalances. And afterwards, I'll be going over just how I give a plug for my clinic and how I treat patients. And at the very end, we'll have a coupon, a discount for anyone who wishes to have a first patient visit with me. So let's jump in. So the first thing I like to do is I like to look at the theory of disease. So with modern medicine, we have conflicting theories of disease. We have the germ theory, and what the germ theory is that the perspective is that you have exogenous problems or germs that infiltrate the body causing disease, like bacteria, viruses, parasites, etc. Now, what in the alternative or naturopathic perspective, we look at stress. So the body can deal with all kinds of stress, all stress, whether it be or disease, whether it be cancer, whether it be infection. The problem is we have chemical stress, emotional stress, and physical stress. And when you have too much in either of those categories, and the body can't compensate anymore, that's when you delve into disease. So that's my perspective, and that's what I do. I locate the chemical, emotional, structural stress in the body, remove it, so the body can simply heal itself. Okay, so let's look at the signs of thyroid imbalance. So these are very common symptoms. You'll be looking for weight gain. You'll be looking for constant fatigue or tiredness. Looking for a muscle soreness or pain. You may have like menstrual problems, dry skin or flaky skin. Your cholesterol may be high. You have poor concentration or poor memory. So all these are symptoms we're looking for. Again, so next we'll be looking at hyperthyroid versus hypothyroid. That's when the thyroid is overactive or underactive. And we'll also be talking about T3 and T4. So let's look at the thyroid axis first. So with the thyroid axis, you have the hypothalamus, which releases the thyroid-releasing hormone, which then triggers the pituitary, which releases thyroid-stimulating hormone, and that triggers the thyroid. And now this is where things get interesting. So the thyroid releases T3 and T4, which increases the metabolism. T3 increases the metabolism short term, T4 increases the metabolism long term. So we need both of them. Now let's talk about, there's 2 points I want to bring up. So first off, in order for the thyroid to release the T3 and T4, it needs compound hydrogen peroxide. And if there's no hydrogen peroxide in the thyroid, then the T3 and T4 simply builds up in the thyroid, in which you get a goiter and enlargements. And what turns off this hydrogen peroxide is low levels of testosterone. Okay, so once the T3, so that's one thing I look at. I look at testosterone levels with thyroid issues. Next, let's say the T3 and T4 is released, right? It's in the bloodstream. Now it needs to be recycled. In order for the T3, T4 to be recycled, there's an enzyme called iodase, and that recycles the T3, T4, and goes back to the thyroid. So it can release more and more T3, T4. So it doesn't have to keep creating new T3, T4, because the body would exhaust itself. And so the question is, what hinders iodase? What hinders the recycling of the T3, T4? And this would be low levels of iodine. So that's what I'm looking at. Low levels of iodine first and low levels of testosterone. And next we're going to talk about the hypo and hyperthyroidism. So typically hypothyroidism is going to be, we're looking at Hashimoto's or thyroiditis. With this, you're going to have weight gain, you're going to have fatigue, you're going to have dry skin, constipation, depression. And so one thing you'll find is if you feel around or if you palpate the thyroid, it's going to be tender. What happens is with Hashimoto's thyroiditis, this is where the immune system itself actually attacks the thyroid gland. So typically with autoimmune diseases, we'll be looking at the guts. And next, we're looking at hyperthyroidism. That's where the thyroid is hyperactive, and that's simply called that Graves' disease. And this is where it's still going to be autoimmune, but this is where instead of turning off the thyroid, it actually activates the thyroid. And you can see if you find people with bulging eyes or even with a goiter, that may indicate a Graves' disease. In this case, hyperthyroidism. All right, so next I want to talk about the glands. So these are things that you need to be looking at. So we have the causes of thyroid. So first look at the thyroid, which is the primary cause. All right, so let's say the thyroid is perfectly fine. Let's say that's not the cause. But what do we look at next? Well, we look at secondary organs. So what could be putting stress? What organs could be putting stress on the thyroid? For this, I'd be looking at the pancreas, the adrenal glands, and the reproductive glands as well. With applied kinesiology, you can test those very quickly. Now with the spine, this is very fascinating. You have different vertebrae in the spine and you have nerves that protrude out of the spine and innervate different organs. So you have, let's see here, and then neck, in the cervical spine, you have certain vertebrae. And if there's a malposition in those vertebrae can actually affect, not necessarily turn off, but also affect the thyroid. So we're also looking at physical stress in the body as well. Okay, now let's look at some additional causes. So right now we're just going down the rabbit hole, looking at multiple causes for a mismanagement of the thyroid gland. So tyrosine, if you might have tyrosine levels may be out of balance. And that could be dietary. You need tyrosine for the T3, T4. You have infection, you get heavy metals. If the diet is poor, obviously low iodine. Adrenal fatigue syndrome, which I've talked about in a different seminar. Especially your emotional state increase if you have high levels of cortisol. If you're constantly in fight or flight, that can cause inflammation in the brain and actually affect the immune system, cause thyroid issues. And again, we talked about the spine issues. And if you eat too many cruciferous vegetables, that can negatively affect the thyroid. So for some people with thyroid issues, we want to be careful how many cruciferous vegetables. That's going to be the broccoli, the kale that they eat. So again, this is just so you can get an idea of like the anatomy. So we're looking at adrenal glands and the kidneys. Here we're looking at the reproductive organs, cervix, the testes. So these are all organs and glands that, again, with alternative medicine, with applied kinesiology, you can look at very quickly and see how they're doing subclinically. So next, I'm going to take a look at the examinations. How do we diagnose whether a person has thyroid issues or not. So clinically, you have first we have clinical and subclinical tests. So clinically, if the thyroid is not doing well, it's been not doing well for many years, then it gets into the clinical stage, and that's where you can actually do your blood test and you can check for T3, T4, check your iodine levels. And by this time, I'm not going to say it's too late, but it's far gone. So my concern more or less is the subclinical stage. I want to, before there's any permanent damage done to the organ or the gland, I want to be able to identify whether the person has thyroid issues, which may not show up on lab exams in hospitals or other clinics. And the subclinical is the most common. So again, you can look at, in the hospitals, you can do, it's called RAIU, metabolic exams. You can look at the hormones, T3, T4, TSH combination. But I want to be able to identify hormone problems before they become a big issue. So let's talk about some non-invasive exams we can do beforehand. So what I would do is I want to look at the basal temperature. So you want to take your temperature in the mornings right when you wake up, and typically it's going to be between 97.6 and 98.5. If it's above or below that, on average, after taking your temperature for a few weeks, then it might give you an idea that you have hyper or hypothyroid issues. Secondly, there's a test called the Achilles reflex, where you tap the Achilles, and based on how quickly the Achilles responds will tell you whether a person is in the hyper or hypothyroid conditions, or have conditions. And a little bit more easy is it's called a teres minor test. The teres minor muscle, we'll take a look at that, but you can actually test the teres minor muscle. And they found that if this muscle is weak, neurologically weak, then it's actually associated with thyroid issues. And lastly, I do iridology, so I want to look at the iris, and with that iridology, you can actually see the thyroid gland represented in the iris. I can see if there's inflammation. I can see where the inflammation is coming from. I can tell if there's constipation or toxins coming from the gut that are stressing out the thyroid. So these are a grouping of very non-invasive tests I can do to determine if a person has thyroid issues. So again, this is the teres minor muscle. This is your, this is your scapula. This is the teres minor muscle right here. That's something that I would check on all my patients. And then here is the iris. So again, you have the iris, and by analyzing the coloration in the iris, I can tell if there's stress or if there's toxic buildup in the different organs of the body, whether it be the small intestines or large intestines or brain. It's very effective. Imagine being able to tell whether a person has thyroid issues simply by looking into their eyes. So again, with applied kinesiology, I'm going to be looking at chemical stress, mental stress, structural stress, and all of these factors, all these categories can cause thyroid issues. So with classic applied kinesiology, you want to, there's many factors I want to look at, but one thing you can do is you can chew thyroid extract, and if that causes the muscles of the body to neurologically strengthen, then that would tell you that you might have some thyroid issues going on. We talk about temperature as well. So again, we want to reduce stress. All right, let's talk about nutrition. Let's talk about treatment now. So with chemical stress, let's say it's dietary. What can we do? The first thing is I would definitely prescribe iodine to my patients if that's an issue, if they're not absorbing enough iodine. And usually you can tell if they have like a thick mucus in their mouth, maybe they need a little iodine. Or vitamin A is very important, as well as called desiccated thyroid extract. So let's say a person does have an autoimmune issue. Desiccated thyroid extract actually gives a buffer, acts as a sponge, and absorbs all the antibodies that are attacking the thyroid. It gives the thyroid a chance to heal itself. So that's very effective. That's something you can get at the Standard Process is a very well-known company in the alternative fields, and they carry a very good thyroid PMG. You can get that on Amazon. Next is homeopathy. Homeopathy is a very effective system of medicine. I talk about it quite a bit. It's practiced in Mexico, in India, and in multiple European countries in their mainstream medical systems. It's very safe. So some of the remedies I would check for my patients would be Nux vomica, Graphitis, Lycopodium, Clavatum, Sepia officinalis, Calcara carbonica. These are all Latin names. And usually you can find these in most supplement stores that are well stocked. And so it's just a little plug-in for homeopathy. I had one patient with epilepsy, and she was having seizures again, even though she had some sort of device that was implanted in her body to turn off the seizures, which it actually didn't work. And she couldn't get an appointment with a medical doctor in time. It was getting really bad, so I prescribed a couple of homeopathic remedies for her. And next day, she was much better. I mean, she said she was having seizures at nighttime. She was afraid to go to sleep. So yep, homeopathy works. Okay, so in terms of the demonstration, let's take a look here. Let me take a look. In terms of demonstration, there's something called neurolymphatic points. It's a little hard to see, but these were found by Dr. Chapman. So if you look at your clavicle, and you have two clavicles, obviously on your right and your left, and if you find your right clavicle, then you feel where the clavicle joins the sternum. You move your fingers down maybe one inch, and you rub that area. If it's tender, that point's actually related to the thyroid. And so the thyroid might be functioning subclinically because the lymphatic system is congested in that spot. So one thing you can do is rub that spot. If it's tender, if it's sharp, keep rubbing it until the pain goes away. Sometimes the bones are malpositioned, need to be corrected. It's very common, especially in the right clavicle. So one thing you can do for yourself is simply rub those spots, and that should actually help the thyroid to function better. All right, so I hope that was helpful to you. Next, I'm going to spend a few minutes just going over how I treat patients in my clinic or at my office. This is what you can expect during your visits. I'll give you an overview. These are the tools I use. I do iridology, homeopathy, applied kinesiology, in which case I want to look at your hormones, let's look at yeast infections, biofilms, which are these little walls that protect germs. I look at heavy metals, environmental toxins, food allergies, microorganisms like bacteria, parasites, viruses, fungi, which are very common, surprisingly. So those are all things I can test for. I also do Bach flower remedies and meridian therapy. So we'll get more into this one by one. So with iridology, we already went over iridology, where by looking at the iris, I can actually see all the systems of the body reflected in the iris, whether it be the lungs, the brain, the nervous system, the gut, and it's just amazing. I've had so many patients who've had just years and years of just chronic issues, and just by looking in their iris, after 20, even 10 seconds, right away I know what the issue is. And I've found people better just by knowing what the actual issue is. So as they say, the eyes never lie. So again, homeopathy. Homeopathy is very effective. There's one remedy called arnica. It's very popular, and it's effective for reducing inflammation and increases healing and decreases swelling. It's common for surgeons and hospitals to prescribe homeopathy, arnica, homeopathically to patients, because their patients after surgery recover to 50% more, especially with plastic surgery, reduces swelling by like a huge percentage, and is very effective against skin issues and skin problems, and really for most things. It's very, very safe, very inexpensive too, which is why pharmaceutical companies hate it so much. Again, with patients, I can look at the systems in the body, the lungs, the heart, the nervous system. You can tell what herbs are needed, what nutrition is needed, and we're not guessing. We can tell very specifically and very clearly what's not just what might be helpful, but what will be helpful for the patients. That way, you don't have to spend hundreds of dollars on multiple vitamins or minerals that may or may not be helpful. Again, with applied kinesiology, it's a wonderful system with medicine. It's put together by Dr. George Goodhart in the 1960s, and it combines many systems of medicine, traditional Chinese medicine, chiropractic medicine, osteopathy, naturopathic medicine. And again, it's a diagnostic system using muscle testing, and allows us to figure out where the stress is in the body, chemical, mental, structural, and it allows us to determine what the solutions are very, very quickly. Again, we have in-house testing, so I'll be looking at hormones, yeast, food allergies, environmental toxins, heavy metals. I had one patient who is a doctor who she had, she couldn't see many patients because for years she had fatigue and just like terrible issues. And using iridology and using in-house testing, we were able to figure out she had a parasite that was going on. We were able to, once we took care of that, then she was much, much better. Treated a dog, where I helped a patient with her dog, and found out that she had parasites, and using this type of testing, and she couldn't control her bowels, but once we helped her out, then she was much better. Yeah, we have Bach flower remedies. There's different flowers. There's many flowers that have a frequency that's actually measurable, and it's therapeutic as well. You can actually bottle these frequencies in tinctures. And with my patients, I figure out what tinctures are helpful for them, and this helps with limiting unconscious beliefs. We say that 80% of our emotions come from the subconscious level, and so this allows me to treat patients at a very, very deep level. Again, we have meridian therapy. I look at the meridians of the body. I can figure out like which meridians are off. Again, the body is essentially a big battery. The energy flows through the body at different times of the day, and so I can figure out which meridians are congested or blocked, and we can fix them. We had one patient, a colleague of mine, and she had diarrhea, And once they found out that the meridian was being blocked in a large toe, once he corrected that blockage and adjusted the toe, the diarrhea went away. Quite remarkable. So Chinese medicine is absolutely no joke. So I don't use needles, I use laser or tapping. And so here's the coupon. The coupon is seminar. If you sign up for a new patient visit as you're going online, it'll ask for a coupon code. Just put the seminar code in and you get $10 off. I hope this was helpful to you, and I hope to see you soon. Bye.